Yes, it's amazing how committed suicide is such a habitual way of our society talking about died by suicide. And I actually found out after my memoir that committed suicide is loaded. It makes it sound as if someone's committed a crime and doesn't highlight the idea that mental illness and suicide are closely connected and that it's a tragedy. And committed also implies blame. So suicide is one of the last areas where there's tremendous stigma around the cause of death. If you had a father that died of a heart attack, you would never feel shame, but the words committed suicide carry with it a tremendous sense that you somehow need to be embarrassed that you've lost a family member. You know, I was just talking with the child psychiatry residents, and they were talking about also times when maybe you have a friend that has a parent that dies by suicide, and as a peer when you're younger you may not end up talking with your friend about that. And suicide is one of those unspeakable elephants in the room, and it's awkward. You don't always have words to put to what happened, and you know, probably the best thing to do is to treat it in the same way you would if you said to someone they died of a heart attack, I'm sorry to hear this happen, and anything I can do to support, if you ever need to talk to me, I'm open to it. But it's hard. So I did, with one of my older sisters, we did go down to the public library because there were, on microfilm, there were discussions about my mother's suicide in the newspapers at that time. So we were reading about them, the two of us, clandestinely together. But it wasn't, you know, in some ways I think, understandably, my father thought we should just move on and not drown in sort of a sense that there was anything strange about that or something, a setback. And I think there's a balance that and it's also the times. I mean, that was back 40 years ago. I do think people are more likely to discuss it with their family members, but I still think there are times when people keep it unspoken because they're not sure what the words are to talk about it. The danger of not sharing this information is, first of all, it is medical information. If you have someone who's died by suicide and they had bipolar disorder or depression, you want to make sure that your children know this so that they're able to both watch for themselves, or if they go on to have children, about what are the early signs of depression or bipolar so we can make sure to treat it. And you want to emphasize the treatment aspects of it. So that's one aspect. The other is there's the telling and the knowing that we talked about, where what you tell a child and what a child knows can be two very different things. So you may think that you haven't told the child about the suicide, but either the child has overheard you talking in adult conversations about what happened, or they may have actually been at the event that happened in a pre-verbal time, and then it can be enormously stressful that they have this guilty secret. So talking about suicide allows you to invite the child to have a conversation and to share their worries. And you don't want a child to worry alone. And most importantly, you don't want to end up having a child find out this information from someone where you didn't get to be the deliverer of it. And they may find it out in the playground or from a friend, and that would be unfortunate.